So a lot of what we see currently in brain health goes back to what we've learned through close psychological study. So if we look at childhood kind of in several segments, and I'm going to save adolescence for one of my colleagues, Dr. Swarter, but very young children, birth to age 2, what we see is the importance of the interaction with the primary caregiver, usually mother. The cuddling, the eye contact with the baby, reflective, kind of moving back and forth, the baby does something, mama does something, and to have a rich environment where there's a lot of interaction with children. We're seeing on functional MRIs and brain studies that is what enriches a child's neuronal growth and social emotional health. Children who don't have that interaction, it's very clear that very soon they fall behind. It's as if the emotional well-being of this early life experience with mother is the foundation by which academic or cognitive health comes later, cognitive ability. Now, from 2 to 5, the preschool years, that's a very important time that even though the child's eyes maybe haven't adjusted into something that would allow them to read, reading to that child, describing the environment, giving them language, has everything to do with them becoming grounded in an interest in reading. So if you push a child to read before age 5, they don't do very well. But if you read to them and you're animated and you enjoy the reading, they'll enjoy the reading. And you can begin to work on things like letters or numbers. Again, though, while that's happening, and that's the academic kinds of growth that the child has, it's that emotional connection that really continues to build this foundation of the child feeling secure, confident, and able to interact and really explore the world. Interestingly enough, we probably learn more from ages 2 to 5 than we do in the rest of our lives. It's amazing how much children can learn. And of course, part of that's been obvious for a long time with language, but a lot of the social development is really key in that age. Learning to be empathetic with others, to connect with others, to start relationships, to have a trusting family, but also venture out from the family and begin to have friends and learn from other trusted adults like teachers. Then if you move into 5 to kind of, say 10, 11 years old, that's where relationships really become much more rich. And also when kids really begin a lot of social development within a school context, within a group context, learning how to get along in a group, how to play sports. And these things are real important in terms of laying a foundation for future success. And again, when we look at brain development, when we actually look at scans, we see healthier brains in children who are able to achieve these kind of rich environment, rich learning environment, and rich social environment. The last group is kind of the tweens, just before adolescence. And this becomes a very challenging time because 20 years ago, children in this group had a different level of protection in terms of social emotional experiences. And that's what a lot of current parents grew up with. Now, what we see is things like media getting younger and younger. Children are able to get on the computer and look at sometimes adult-type materials at an earlier and earlier age. And we're also seeing more and more kids having distress and signs of mental illness. In fact, a good point to make is that the childhood brain, even from 0 to 12 or 14, is no more immune to mental illness or the challenges of anxiety, depression, mental illness than an adult brain. So when we begin to see signs of early mental illness, early brain disease, or brain challenges, if you will, we do know that early intervention actually can calm down the process that leads to more challenges, more pathology, if you will. And so early treatment is actually preventative of an illness getting worse later in life. So this is a really key concept because when we look at a 3-year-old, we just see a wonderful child that we think, the world is their oyster. But in fact, and one of the reasons it's hard to identify sometimes a child in distress is they have long periods where they look pretty happy and healthy, and then they'll have periods of looking anxious or depressed. And so it's a good time to get an evaluation and understanding of that child's world. It's also true that exposure to alcohol and drugs, when we get to these tweens, things like marijuana, that some adults may feel is not so toxic given some of the legislature that's being passed on in several states that marijuana might be medicinal in some way. In fact, early exposure exposure as a teenager or a preteen really increases the risk of things like schizophrenia, 3 times the risk. And schizophrenia is not a rare problem. It also primes the brain for much more high incidence of other substance abuse, alcohol and drug problems later in life. So if we can protect kids during childhood, a lot of these substances aren't near as toxic to the brain later in life, but we really want to protect children's early development. Symptoms or concerns about a child's brain health are very different than adolescence at times. Sometimes they're similar, but I'll go back to those kind of 4 periods that come before adolescence to look at that, because the behaviors of infants before a child's able to be verbal, they do show us their feelings. And a child who is struggling with depression or anxiety, as you might imagine, they cry a lot more. They have more signs of distress, and they have more difficulty learning to self-regulate. And there's a lot that we can do with the dyad. And by dyad, we mean not just the baby, but the parent, the mother, child. There was a pediatrician named Winnicott who said there's really no such thing as a baby. There's the baby-mother combination, because babies don't exist outside of having somebody who really takes care of their every need. So looking at the quality of the relationship and the interaction is really key in that early stage. And one of the therapies we can use is called parent-child or child-parent psychotherapy that looks at the relationship as much as the child. Now, in preschool years, kids can look depressed 1 minute and look just fine for sometimes a period of time. Then they go back into appearing sad, having more difficulty playing, maybe feeling more insecure. And there are children who are shy, they're naturally shy, and they kind of watch before they jump in. And that doesn't necessarily mean they're depressed at all. It just means that's kind of their constitution. But there's children who are normally very interactive, very engaging, and as they begin to pull away from that, we know that their neurochemistry, the chemicals in the brain that have to do with feeling and well-being, are being altered. And one of the interesting things when we do functional MRIs is whether a person gets psychotherapy or whether they get medication or whether they might get better on their own, you can see the difference in the brain chemistry and how the brain functions from when they're struggling to when they're healthy. So it doesn't really matter whether you get medication to get better or psychotherapy to get better, or what we find is what works best is actually using both together. But you'll see the brain get healthy when we do a scan. Now, school-age children, some of the indicators can be disengagement, not wanting to go to school, having difficulty interacting with peers, becoming more disruptive in the classroom. In a child who's not really struggled with behavioral problems, one of the early signs of depression or anxiety or even trauma can be that the child becomes more anxious, more angry, more disruptive, more likely to not follow the rules. Now, with the children who are kind of transitioning from childhood into adolescence, this is a time where it becomes especially difficult to tell what's kind of normal, healthy behavior and what isn't, because hormones begin to kick in. Kids can become quite moody as a natural part of their development, but they can also then get into some delicate situations where suddenly they're struggling and they're not doing well. Relationships can become really important. We see children in this age group and high school age where if they have a conflict with a peer, or maybe they're trying to date, or they imagine themselves to be dating, but then they feel rejection, that can trigger a really severe emotional response that sometimes, even though it may not be a persistent depression, it still can lead to self-injurious behavior or behaviors that are at risk for wanting to harm oneself. Now, what's interesting throughout all this, what really gives children more resiliency and the ability to cope with this is the quality of their relationships. The connectedness, especially with family in early childhood, is probably one of the best protective factors. So a parent, a teacher having that connection where they're willing to sit down and spend even 10, 15 minutes with a child, just open-ended, like following the child. How's your day? What's been happening? Oh, I noticed you seem sad about something. Can you tell me about that? Opening those doors, even on good days, if you open those doors, when a bad day comes along, it's a pathway that you've used over and over, and it's easy for the child to get back to that. Whereas if you wait to have those meaningful conversations to where you know your child's in distress, they're going to blow you off. They're going to say, I don't want to talk to you. But if you're used to doing that, then they're more likely to open up. And also, you kind of get a better idea of what's their normal up and down, to where if they go way down, then you kind of like, wait, this isn't what I've been seeing. So it doesn't have to be a lot of time, but it does need to be regularly paced and kind of following the child. Current research over the past 5 years, what we've seen over and over is that children are being challenged by more and more things at younger and younger ages. And that we've also seen that when children do get help and support, that they respond very positively. There was a study called the Teenage Anxiety and Depressive Study, multiple cities across the country, that looked at how kids respond to treatment for anxiety and depression. And what they found is about 40% of children respond to psychotherapy early in their treatment. Now, if they stay in psychotherapy over time, over 6 months, that 40% jumps up to 60%. But over time, early on, if you can give medication, about 70% respond to medication. And if you're able to give both, 85% will respond. So the combination is really the safest approach. Now, if they're just getting medication, they actually fall a little bit over the 6 months. So at 6 months, it's hard to tell the difference between the child who just gets psychotherapy and the child who just gets medication. But the children who get both actually remain highly resilient, still up at 85%. Carrying that into other things, what we've seen is that more and more children are being challenged by social media, by bullying, by exposure to media and adult content, and even more and more kids are being affected by drugs and alcohol. Not only by their peer group, younger and younger using drugs, but more and more parents are being challenged right now, especially with the opiate epidemic. So one of the things I think that's very encouraging for parents and for community mental health providers and for teachers and counselors is that the quality of our relationships with children is really the foundation. It's the backbone to kids being healthy and resilient, and it's also the safety net for kids who are in trouble. One of the best things that any of us can do is have that ability to share personal care and concern for a child. I work a lot with the public schools. I was a school teacher before I went to medical school. And it doesn't have to be a protracted period of time, but that check-in that you do with each student and that sense of when a child has something additional that they really need to talk about, that sense of a relationship that even though you may not have enough time to fully explore what it is as a major concern for that child, that they trust you enough to say, oh, I think this would be good to talk to the counselor. Or can I help you by, can we talk to your parents together about this conflict or problem or feeling that they're having? A lot of children struggle to express their emotions, and it's good to have a good skill set, a good interviewing skill set to follow a child and help them open up. When I work with medical students and residents and even families, I try to help them remember that when a child has feelings to talk about, it's a little bit like having a flower that blossoms. You kind of want to be present. You just kind of have to watch it, maybe encourage it in a little way. But if you really go at it and try to make it open before it's ready, the petals just fall off, and it's not the same thing. So it's important to be able to pace yourself, show interest, understanding, empathy, support for a child, and then they blossom with that type of thing in terms of revealing their inner world and their experiences. The other thing that I would say is having a cohesive group, having parents work with teachers and teachers work with counselors and even mental health professionals, having that all coordinated together, know that they can hand off to each other and support each other's efforts is really key to having a child who really feels protected, supported, and a child who's ready to face the challenges that may come with mental health. Unfortunately, mental health issues are very, very common. One of the things we've learned from studying epidemiology, which is the study of all illness, is if you pile up all the physical illness, it comes from your lungs, your guts, your bones, your hormone-producing organs, that pile is the same size as the pile that is for mental illness. So everyone understands, oh, you got a cold or you have the flu, things happen. We need to be just as warm and empathetic and understanding and interested in helping people with the challenges of brain health, because that pile is just as big. So it's just as common that we're going to have a challenge that occurs within our family. And knowing that it's okay to get help, outcomes are much better. So working together as a team is really key. So some of the best recommendations I can give for supporting the mental health and brain health of children has to do with accepting that we all have a part in each other's lives, and we need to support families that are challenged. What we've known about early childhood education is that it pays huge benefits, especially for families who are challenged. A number of major cities are trying to get public support for education between 3 and 5. It's been there for families that are challenged under Head Start, but it's really, it shows huge benefits by making that a given, that people can do that. And the burden of childcare is really pretty expensive. So the other thing that's needed, that's really key, is the more we can share information about child development and how to support parents, because it's a challenging world these days. And it's not only challenging for the parents, it's challenging for the kids as they separate from their family and they spend more time in schools. So giving the schools and the families good information about what's normal development, but also what are the toils and snares that tend to throw us off, and then how to get somebody the support they need to get right back in line, in track, where they feel good, they feel healthy, they feel supported. It really takes a team to do that. So those would be the keys that I see right now. So I've spoken about child development specialists and teachers and supports, and I want to spend a little bit of extra time talking about the relationship that families have with the pediatrician, because pediatricians are so well versed in normal, healthy development. And they're some of the most dedicated physicians I've worked with in terms of really wanting to understand children and families and the challenges. It's also, unfortunately, true that the number of child psychiatrists in the country is desperately low. It's been the area of most need in all of medicine for the last 25 years, and it's been projected that it's going to be like that for the next 25 years. And so we know pediatricians have an added burden, if you will, to help with mental health, and they're really pretty good at it. So I think if you have concerns about how your child's functioning, is there a problem or not, it's an excellent idea to bring that up in a pediatric visit. Pediatricians have a really good idea of normal, healthy development. They do a nice job of screening for children that are being challenged by alcohol, drugs, anxiety, depression, and even ACEs, which I think we have a whole special section on. What we do know is that when children are challenged by trauma, that early event starts a different cascade of emotional well-being for that child, and also how the neurochemistry of the brain works. And it has a dramatic effect, not just upon brain health, but also physical health, possibly for the rest of the person's life. And pediatricians are really well suited to identifying those concerns, helping the family understand what they might do with that, and sometimes referring or connecting that family with excellent resources.